Hi, so introduce yourself.
Hello, I am Dr. Deexa Sinha. So I am a third year resident, exam going batch of Department of Pathology in Agartala Government Medical College. I did my UG from Tripura Medical College.
So, happy Diwali and welcome. Happy Diwali for you. First, let me ask about the setup of your department.
We have two professors, including my HOD, and we have two associate professors, and we have two assistant professors and three SRs.
So, how many PG seats are there in each batch?
And so there are 4 seats, 2 of which are for the state quota and 2 of which are given for the All India quota.
Tell me how a daily routine of a pathology resident in AGMC looks like.
Our work starts at 9:15 around. So we go at around, we reach the department by 9:50 and then we start with our morning work. Whatever is left of the previous day's work and all the backlogs and everything, we sort it out. First, actually, I would like to tell about the sections. Pathology deals with mainly 4 sections. So the sections are histopathology, cytopathology, hematology, and clinical pathology. So PGs in our department are divided and posted in different sections. So based on the sections, we have senior and juniors in one section, and we coordinate and work together. If suppose it is a histopathology section. So in the morning, we start with our grossing. The grossing of the specimens that we receive after the ODs of the surgical departments. Okay. And after the grossing is done, we then sit for slide examinations. So we screen the slides and then we go for reporting. So we can screen the slides on the previous day as well. If we get the slides, then we screen beforehand. And then in the morning, we sit out with our consultants and help in reporting. And similarly, in cytopathology, the patients start coming from the OPD to our section at around 10 a.m. So 10:30. So from there, we start the cytopathology, FNSC and other things in the cytopathology section. In hematopathology, basically we get the slides at around afternoon, the indoor slides, and we dispatch the indoor slides the same day. So we start with that as well. And basically that is the gist of the work that we do. Our time duration, it basically extends to at least 4:35.
4:35.
Yes. Yes. That is that is the usual time by which we finish the work.
Okay.
Yeah. So after that, rest of the work like screening and all, those might extend to 5:30.
5:30. Okay. So do you have like night postings or emergency duties?
We do have night duties where we see the emergency investigations, but those are very limited.
Okay.
We have alternate postings. Since pathology is a subject that we deal with in our UG, but we barely scrape off the superficial levels of pathology during our UG. Even when I took this subject as my PG, I had basically zero clue about the things that I am going to do in my future, the things that I am going to work with.
Tell me, how is your rapport with your fellow colleagues, seniors and juniors?
Yeah. So my rapport is really wonderful actually. So I have very lovely juniors and baby juniors as well. So and I had lovely seniors who had a very important role in teaching me how to deal with the things, day-to-day things and work in our department. I would like to stress we are 3 PGs per batch. In each of the batches that is there right now, we are 3 PGs.
So one seat goes waste, it means.
Yes, I would like to throw light.
I want to ask you that one particular seat is history of the state quota or the all India quota.
Yeah, I would like to tell you about that. This is one very important thing that should be thrown light upon. So basically, there are 2 seats of the state. So the state people, they usually take up both of the seats, and the All India people, there are 2 seats for the All India quota as well. So in the previous 3 years, basically 1 seat of the All India quota has been to waste. Unfortunately,
that's what we can.
Yeah.
So you're by the way from?
I'm from Assam. So I did my UG from here, as I mentioned. Basically, this place is a lovely place. I was comfortable with the language as well.
Sure. So Diksha, tell me about the food and culture in Tripura. How are you adjusting to it?
adjusting very well to Tripura. So the food here is absolutely fine. Just it might be a little bit difficult for vegetarians to get food here, but then there are options for that as well.
About the work culture in the Department of Pathology.
So the work culture is very good here. We have absolutely wonderful teachers. Our professors are very supportive. In fact, they will make sure that we learn pathology and we get out of here only and only if we learn it.
So Deeksha, tell me about the academics in Department of Pathology.
Yeah, so basically in our department, it is full non-active academics. So we have 2 seminars in a week, one slide seminar and one journal or a seminar. So slide seminar is a very important academic session that is to be held in our department. Beforehand, we have to deal with the slides and we have to identify what is the diagnosis. So in most of the colleges I have heard, with my batchmates, not many slide seminars are being taken in many colleges actually. So, but in our college, they are full on, hands-on. You will be attending slide seminars every week. There's not going to be any slack in that.
So do you get the opportunity to go out for the conferences or any workshops outside Tripura?
Yes, definitely. So our HOD he's a very dynamic person. So he always encourages us to further go and attend all kinds of CMEs, and we also present in the conferences. He is very upfront with that, okay, you have to go and present a paper and a poster. So it's not just for the PG, but then you have to do it. And they always make sure that we give our best performance there.
That's commendable. So my next question is, so what do you do in your free time?
So during my free time, I basically have very sweet set of friends. I hang out with them. I also go to the gym and I listen to music.
So tell me about the leave system, like how many leaves you get per month and hafte mein kitna, like within a week how much leaves you can get.
So at least in AGMC Pathology, you don't really have to think about leaves. If there is a leave for a PG, you will get it. If you have an important thing to attend, you will definitely get it. There is never an issue with leave till date. Yeah, so basically Sundays are free and Saturdays over here in Tripura, it's alternate. Second Saturdays and fourth Saturdays are off. Yeah, so all the OPT days we also have open.
So tell me what advice you would like to give to pathology residents, aspirants.
Basically, if you are interested, if you have your heart and soul in pathology, definitely take it. It is a subject for the nerds, okay? So the nerdiest of the nerds of the medical, that is what brings us here.
Deeksha, tell me why you took up pathology as your specialization.
I always wanted to take up pathology. During my internship, I kept ruling out all the subjects that I wanted to do a PG from. So by the end of it, I was very much decided that I am going to take up a subject where I have limited interactions with patients. So basically, I really wanted to take this subject. Also, I would like to add one more thing. Pathology is a subject where I feel like I am a detective. So basically, we get all the cases from different subjects, different surgical subjects, and we have to hit our brain, hit our mind, and find out the diagnosis. So it's a really fun work. It's really fun. And also, if you have a good rapport with your co-PGs, then it's really worthwhile.
So Deeksha, tell me about super specialization in pathology.
So basically, you can do super specialty in oncopathology, hematopathology, and histopathology, and many other subjects are there. So also, we can opt for fellowships as well in India, and we can also opt for FRC path as well. So these are basically the options that we can opt for after MD. So basically, thank you, Ananya, for calling me here to speak about my department. I hope a lot of aspirants will be benefiting from this video. If you have any further queries, please feel free to ask in the comment section, and I will be responding to them.
Pura practice kar diya hai. So thanks for coming and all the best for exams. That's a wrap up. So let's take a picture for the thumbnail. Happy Diwali.